One of you had queried about why we consider biphasic CPAP as inferior to ventilator-delivered NIPPV. So biphasic CPAP is delivered by different machines. We have the CPAP from YS and we have Medin from Hamilton. These have the ability to give biphasic CPAP. And the reason we call it biphasic CPAP is because it works on the infant flow principle, and we have two levels of positive and expiratory pressure. So we have the continuous CPAP pressure, and on top of that it generates a PIP-like setting. It's PIP-like because it's not actually the PIP. You can adjust the inspiratory time, and in the biphasic CPAP, the CPAP, you have the ability to trigger versus not use trigger as well, using the Grace B capsule on the abdominal wall. Because it's flow driven, the abdominal distension and related effects are more with this biphasic CPAP. It's not valve regulated as it is in the ventilator driven NIPPV. So we have the ability to go only 4 or 5 centimeter above the set PEEP as a PIP level, higher pressure level. So if we have a pressure PEEP of 6 or 7, we may give a PIP of 12 or so. And the delivery depends on obviously the interface that you use for the biphasic CPAP. In case of the ventilator delivered NIPPV, you can use a ram cannula or you can use the interface delivered with the ventilator, and you have the ability to go much higher on the PIP. Remember, as we discussed earlier, if you're using a ram cannula, you need to use 30% compensation or so for the circuit compliance issues, resistance in the ram cannula itself. So we have a PIP of 20 or 25 over a PIP of 6 or so that you can go comfortably, and it's almost similar to the settings you set on ventilation. So you may call it PCCMV in some ventilators, non-invasive modes, and you may call it NIPPV in some other ventilators. Most of these are not synchronized, but recently we have option to synchronize with the ventilator level sensor as well. So this is just to clarify that with biphasic CPAP we have a limitation. It's more a dual level CPAP rather than proper NIPPV, and nasal high frequency is coming up as well, and it's interesting to note you can deliver a higher map with that as well. So we have to compare these now and see what works best. In my view, NIPPV using the ventilator is better than biphasic CPAP, and the third in the choice will be the regular CPAP, of course. And remember that using a high level of PEEP on CPAP may work the same way. So it's about the map generated that is maintained. So it may not be really the mode between biphasic CPAP and CPAP. It's just our ability to overcome our PEEPophobia when we have two levels of pressure. We are driving up the map without actually increasing the set CPAP pressure, which we are scared that CPAP of 8 or so may be harmful to the baby. So if you overcome that, as it happened in the recent study about extubation of babies to a higher CPAP level in Australia, so you would see that the results are almost comparable. So non-invasive ventilation as a group, if you overcome PEEPophobia, probably they all work the same, but make sure you monitor the perfusion, that you're not causing over distension, and you wean as soon as a baby improves. Go clinically, don't go by set time frames. I hope this helps. Thank you.